clip, we're going to look at the pelvis. So we'll go to some pictures first. Okay, so the pelvis is really a collection of bones. So we're going to look at, we have two coxal bones, they're called. So this would be one, okay, connected here. And this is the other one, all right. And they connect at the front of the symphysis pubis. And then the lower part of the vertebral column, the sacrum, closes it at the back. So the pelvis articulates posteriorly with the sacrum. And don't forget, well, you can't see it there, but the little coccyx at the end. So we have two coxal bones. We'll look at them individually. Now the coxal bones are divided. I'm going to go to this picture here. Now what we're looking at here is one is an interior view and one's an exterior view. So this would be where your hip bone, your femur would articulate right there. So that's the outside. This is where they connect. In actual fact, the sacrum would be back here. This one's flipped over so you can see what the inside would look like. Okay, so now in your textbook there'll be lots of pictures, a little bit different pictures. So the coxal bone's divided into three areas. The ilium, okay, that's this part up here, all right, and the pubis, which is the red part right here, okay, and the ischium right here. So let's go back to the previous picture, okay. So you see here's the pubis part here. That's where it's connected together. Okay, the ilium is the largest portion and it flares upwards. This is what we would touch, like when you're touching your hip bones and the sides, this is what you're feeling right here. And the outer margin, we call that the iliac crest. The symphysis pubis is where they come together in the front. There's a bit of fibrocartilage right there to join them. It's one of those immovable type joints. The ischium is the lower portion of the coxal bone, and there's something called the ischial tuberosities. Let's go to that picture and see where they are. Right here. Okay, so this is really what you're sitting on when you sit down, your ischial tuberosities. And as well, you see there's a hole created by the junction of the pubis and the ischium, and that's allows for ligaments and things to go down through to, or not ligaments, sorry, vessels to go down into the lower leg and nerves. But the ischial tuberosities, much of your leg muscle ligaments are attached to that. The acetabulum, which you see right here, okay, is a cup-shaped depression. I'm going to go back to this picture. So it's right here as well. And that acetabulum, this is where your leg bone would fit in there. So the head of the femur would articulate with that. The ischial spines are an interior marking. I'm going to show you on the other picture right here, okay? They're right here. And the textbook, your picture in your textbook shows it quite well as well. Okay, so the ischial spines would be inside right around here somewhere. Okay, this is the male pelvis down here because it's narrower. You can see that. So right around here. And what's important about the ischial spines is that it creates the narrowest, it would measure the narrowest inlet of the pelvic passageway for a baby. Okay, so if a doctor was doing an internal exam, they would try to see if they could feel those ischial spines so that they could determine how narrow the pelvis would be and what would be the relationship to the baby's heads. The sacral promontory is this piece right here, and it's the most inward piece, okay? Bulges into the pelvic cavity, and again, that's an important obstetrical landmark because that's another hump, if you will, that the baby would have to pass through. And as we say, the obturator foramen, okay, and it shows you better on this on the other picture, are openings for nerves and vessels to pass through to the thigh area. Now, let's just go to the picture. So again, you may be able to see, I don't know if you can see it as well, but what they've done is they've done what we call pelvimetry, taking a look at the pelvic bones particularly. So this would be the sacropromontory. Your ischial spines would be in here. Okay, and you can see there's the femur articulating with the acetabulum. This picture is just showing us I like to put it in there because I wanted you to see that some spines are more curved than others. You may have heard or know someone who has scoliosis, which is an S-shaped curve to one side. Now, sometimes it's quite prominent and the person has quite a bit of disfigurement, or sometimes it's just very slight. It's most often picked up around puberty. Once the growth of the spine is pretty much complete, and the doctor may ask the child to bend over to see if the hips are even when they look at them. Okay, if one hip's higher than the other, then they would suspect that this might be the case. This is a kyphosis and, of course, a lordosis with an exaggerated small of the back.